Welcome to this presentation on protecting human research subjects. I'm here to guide you through the key components and functions of Carilion Clinic's Human Research Protections Office, or HRPO, and our Institutional Review Board process. By the end of this presentation, you will be able to do the following. But more importantly, you will be able to know the integral components needed to facilitate a research project at Carilion Clinic. The Human Research Protections Office is the department that oversees the Institutional Review Board. It is commonly referred to as the IRB office. Our office also offers education and outreach, as well as supports quality assurance and improvement activities. Carillion's IRB has oversight authority for all research involving Carillion's patients, employees, or facilities. Currently, our office oversees 500 research studies and supports over 200 researchers across the organization, and it continues to grow. Our mission is stated on this slide, and it should be noted that our goal is also to protect our researchers by providing them with the knowledge of regulatory requirements and processes to successfully conduct research at Carilion Clinic. Our HRPO team includes 6 dedicated professionals with expertise in regulatory affairs, operations, and education. The best way to reach all of us is to email at irb@carillionclinic.org or visit our website at the following. Dr. Robert Tressman serves as our institutional official. This is a federally regulated appointment that legally authorizes him to act for the institution and assume overall responsibility for research compliance. The foundation of our research oversight begins with our institutional assurance. Dr. Tressman signs the Office for Human Research Protection's federal-wide assurance, which is a legal document that obligates Carilion Clinic to adhere to specific terms and requirements. This assurance is both an affirmation to the Department of Health and Human Services that will follow regulations and the legal agreement required to receive federal research funding. All Carilion Clinic research, regardless of the funding source, follows the Belmont Report principles, complies with the Common Rule, and meets other applicable regulations. Through this assurance, we commit to monitoring research, reporting compliance issues, providing training, and maintaining proper oversight. A broad overview of an IRB is a federally mandated committee with a specific structure requirement. IRBs have to have at least 5 members, including at least 1 scientist and 1 non scientist, plus 1 member unaffiliated with our institution. Importantly, no IRB member can participate in reviewing any project where they have a conflicting interest except to provide information when requested. Now, specific to Carilion Clinic, we operate 2 IRB committees that meet monthly, plus a third committee that convenes as needed. Each committee includes 13 members, led by our IRB chair and vice chairs. Our members represent diverse medical specialties. If a member does not have the specialty or expertise to review a specific study, a consultation from another institution will be completed and be reviewed before the board. Our leadership team includes Dr. Charlie Sloopner as the IRB chair, Dr. Glenn Edwards as the vice chair for Committee A, and Dr. Elvis Pagan as the vice chair for Committee B. The IRB evaluates every research submission using criteria outlined in Federal Regulations 45, Code of Federal Regulation 46.111, and 21 Code of Federal Regulations 56.111. Think of these as the criteria for approval flashcards. All of these questions have to be thoroughly answered for each study. Each of these elements must meet regulatory standards for approval. Now let's focus on regulations and ethical frameworks. These were thoroughly explored in city training, so I will highlight important aspects of each. 45 CFR Part 46, known as the Common Rule, is our primary regulatory framework. It establishes three core principles from the Belmont Report. The key components that run our office are listed here on the right. Please take a moment or feel free to pause this video to read over each of these. The common rule includes four subparts. Subpart A covers basic protection for all research participants. Subparts B, C, and D provide additional protections for vulnerable populations. Personally, the way I think of each is Subpart B can be correlated with babies, Subpart C would be convicted, and Subpart D would be dependents. Our protective mechanisms were established in these foundational documents. It is important to note that these are not stagnant documents and are revised as society evolves, and these are done as needed. The Belmont Report was published in 1979 and it still remains our ethical foundation. This is again where the core ethical principles lie. As you know, HIPAA protects patients' protected health information. HIPAA allows researchers to access PHI when necessary for research, but not all research is subject to HIPAA, only studies that use or create PHI. Studies using PHI must either include HIPAA authorization in consent forms or request a HIPAA waiver. At Carilion Clinic, our IRB serves as the required privacy board, reviewing and approving requests for waivers and PHI disclosures. Project pathways at Carilion Clinic. According to federal regulations, these two definitions will guide your research project. Some keywords I want to point out to you within these definitions are the following. Under research, remember, is it a systematic investigation? Is it going to expand a knowledge base? For human subject, the keywords that are important is living individual, is an intervention taking place or an interaction, and does it generate identifiable private information or identifiable biospecimens? If your project meets both definitions, it qualifies as regulated research and requires IRB approval before proceeding. The FDA has their own unique definition of human subject. It is a broader definition that applies to de-identified or non-identifiable data that would not be considered a human subject under other regulations like the Common Rule. So it is important to note that the FDA, again, has its own definition of a human subject. It is important to distinguish between research and quality activities. Quality assurance projects ensure known quality through internal auditing without infringing on patients' privacy or posing additional risk. Quality improvement projects determine a quality and improve patient services within specific institutional settings, intended to motivate local practice changes within Carilion Clinic. Our review process includes several pathways. Projects may qualify as non-human subject research, or they may require exempt, expedited, or full board review depending on the risk level and regulatory criteria. Full board review is required for research involving greater than minimal risk. These studies require amendments for any changes, must report promptly reportable events when appropriate, typically need continuing review, and must submit a conclusion when complete. Expedited review covers minimal risk research falling into 7 specific regulatory categories, such as blood collection within certain limits, non-invasive data collection, or survey research. Most expedited studies won't need continuing review under the revised common rule, though they'll have annual check ins. Exempt research involves very minimal risk and falls into 8 specific categories, including educational research, publicly available data studies, and certain behavioral interventions. Remember, only the IRB can make exemption determinations, not researchers themselves. Think through your study design completely before starting your IRB application. Ensure content is complete and consistent throughout. Incomplete or unclear applications increase approval time, can waste resources, and potentially put participants at risk if recruitment procedures or consent processes are not well written. When you submit your IRB application, it needs to include detailed protocols for subject population, recruitment process, informed consent, privacy and confidentiality protections, data management, study procedures, any drugs or devices used, risk assessment, minimization strategies, and cost or compensation plans. Informed consent is both a process and documentation requirement. You can use Carillion Clinic's consent templates, which are available on our website, along with our guidance materials and training resources. Federal regulations require both obtaining informed consent and properly documenting the consent process. Once you start a study, you will need to contact the IRB office for initial study submissions, continuing reviews, amendments for any changes, promptly reportable events including unanticipated problems and noncompliance, along with study conclusions. The submission process involves several steps. Here is a nice visual aid that provides an overview. After PI and department chair sign-offs and compliance review, we will receive the pre-review and may return it for corrections. These are also referred to as stipulations. Then we will conduct a formal IRB review leading to the approval of the study. Again, here are the potential paths forward for projects. For non-human subject research, or NHSR, formal IRB determination isn't required, but it is highly recommended if you plan to present or publish findings. Several publications require IRB approval letters, and our office cannot do it retroactively. Other important notes are to use secure data storage like RedCap or Spark, and remember, HIPAA still applies to healthcare information. IRB approval means your research meets ethical standards and regulatory requirements. This approval must be obtained before beginning any research activities. It is typically requires continuing review and any study modifications need approval. You must promptly report unanticipated problems and noncompliance may result in suspension or termination. IRB approval is mandatory for federally funded research, required for FDA regulated studies, needed for publication in peer reviewed journals, and demonstrates your commitment to ethical standards while enhancing research credibility. Any changes to approved studies require IRB review and approval before implementation. This includes changes to procedures, team members, recruitment strategies, consent documents, data collection methods, study sites or timelines. Submit changes using our research change update form in PRISM, and remember, implementing unimproved changes constitutes noncompliance. For multi-site research, IRB reliance agreements allow institutions to rely on external IRBs for review and approval. Several factors determine which IRB serves as the IRB of record. We have resources available on our website to help you navigate these collaborative arrangements. You may also contact our office directly with any questions in regards to multi-site research. These study procedures we just discussed will be completed and submitted utilizing PRISM. PRISM stands for Partnership in Research Integrity and Subject Safety Submission Module, our electronic IRB system. For the best experience, use Chrome, Firefox, or Edge browsers and always allow pop-ups for the site to function properly. Navigate to CarillionClinicImedress.net and log in with your Carillion ID and password. If you have access issues, review our Getting Access user guide on our website or email us directly. If you need help determining what application type you need to fill out, click the question mark button and definitions will be provided for each application that are in PRISM. You will navigate through multiple sections depending on your study type, with questions that branch based on your specific research. Save your work frequently using the Save Section button. This is a screenshot of the study dashboard where you can access protocol items, submit post-approval forms, and review submission history. This is your central study hub for ongoing study management. We provide comprehensive user guides covering system access, navigation, application submission, PI sign-off procedures, and responding to IRB requests. These step-by-step guides will help you successfully navigate the system and can be found on our website. So let's review everything we have covered. Here is a list of human subject research examples to give you an idea of studies that require IRB review. Please read over each of these, or feel free to pause the video to have a closer look. In comparison, here are examples of non-research activities or non-human subjects research. These do not require IRB review. Again, please feel free to pause the videos to read over each of these with more detail. Common mistakes that can occur include not planning, incomplete PRISM applications, missing city training, contradictory information, inadequate data safety monitoring plans, poorly written consent forms, missing supporting documents, and unspecified external collaborator information. Our system provides guidance to help avoid these issues, and it can be found in the help section of PRISM and also on our website. When determining if you need IRB review, ask these questions. Does your project involve human subjects? Is it research designed to contribute to generalizable knowledge? Does it fit a specific non-human subject research category? However, when in doubt, consult with us or submit for formal determination. We're committed to supporting researchers throughout the process. We provide consultations for study development, assistance preparing research materials, continuous guidance after approval, post-approval monitoring, PRISM training, ongoing education, and study development support. We recommend early communication for complex scenarios involving multi-site collaborations, FDA requirements, vulnerable populations, or special study designs. Thank you for your attention to this important training. Protecting human research subjects is fundamental to conducting ethical, high-quality research. Our HRPO team is here to support you throughout your research journey. For any questions or research needs, please contact us at irb@carillionclinic.org or visit our website, carillionclinic.org/IRB. We look forward to working with you to ensure your research meets the highest ethical and regulatory standards while advancing medical knowledge and improving patient care. Remember, We're here as your partners in research, not barriers to it. Early consultation and careful planning lead to smoother approvals and better research outcomes for everyone involved. Thank you.